Hey guys, it's me, Dr. Smina Rahman, Gyno Girl. I've had this uptick in the last few weeks of Bartholin cyst, so I thought I should do a video on it. So today we're going to talk about what is the Bartholin's gland, what is a Bartholin cyst, when should we treat it, and how it is usually treated. And, hopefully you get some answers. So let's get at it. Hi everyone, it's me, Dr. Smina Rahman, Gyno Girl. Excited to be here for another episode today of Gyno Girl TV to talk to you guys about another interesting topic around women's sexual health. For those of you who don't know me, I am a sex med gynecologist and a menopause specialist in downtown Chicago. I have a solo practice with a physician associate, Jessica Bergman, and we practice in downtown Chicago in the Fulton Market area. I also have a physical therapist, Grace Preet, who is an amazing pelvic floor physical therapist that helps my patients. Please like and subscribe to my channel. I would love to see you with your comments and also any further episodes you'd like to see. As a sex med gynecologist, I see everything around the vulva, and one of our sexual organs is the vulva. And the vulva, remember my little vulva puppet friend here, we're going to talk about one aspect of the vulva, which is the Bartholin's gland. The Bartholin's gland, so remember the vulva puppet? And so we have our vulva puppet, your labia majora, your labia minora, your clitoral hood, your clitoris, the urethra from where you pee from, your vulvar vestibule here, and then down here at the 5 and 7 o'clock position. We consider this like a clock when we talk about the vestibule. So at the 5 and 7 o'clock position are two glands called the Bartholin's glands. And it's named after a Danish anatomist, Casper Bartholin, who made the first detailed study of physiology and anatomy in human females. I just read that. So that's what these glands are here at the 5 and 7 o'clock position. They are a very important piece of tissue, the glands down here. So these glands are located, again, if this is a clock, at the 5 and the 7 o'clock position. They are responsible for releasing mucin during arousal, so helps with that lubrication that we feel during the phase of sexual arousal. They're about 2.5 centimeters ducts, and they allow for the fluid to come down, and they are at the local, within the vestibule there. And so, of course, we always talk about the vestibule in my practice, and the Bartholin's glands are located here. And they're actually innervated by a branch of the pudendal nerve. The Bartholin's glands are, important for the arousal that we have during our sexual response. And they release mucin at that time and are really important. Well, what happens sometimes, you may not ever notice them because they're in the vestibule down there. And if you don't have vestibular pain, you may not even know they're there, except for the fact that you get wet when you're aroused. And that's one of the contributing areas. And so what happens when those glands, or the ducts, the 2.5 centimeter ducts that kind of the fluid travels in, what happens when the ducts get obstructed? Well, when the ducts get obstructed, you get a fluid-filled sac or a cyst that forms. And so that is how we get these Bartholin's gland cysts. And, as long as there's no issue with the innervation down there, had previous surgery to remove anything down there, then it will continue to produce the mucin even with the obstruction. And that's when the cyst walls form, and that's when you get these, like almost when people get them on both sides, it's like having two balls down there. Otherwise, I'm going to show you a picture of some patients here and here that have it unilaterally. And sometimes, they can be very uncomfortable. They can cause pain. When the fluid becomes infected, it becomes a Bartholin's gland abscess. And it's really important that you get evaluated and treated when you get these cysts form. Obviously, most patients do notice some sort of pressure or pain down there. Most of the time, Bartholin's cysts are associated with sexual dysfunction, which is why we talk about them so much. There's been studies to show that 73% have dryness, and so they lack arousal when they get that cyst formation. There's been studies show that you get pain with arousal when you get Bartholin's gland cyst or abscesses. You can have pain, and that's in 82% of a population that was studied with Dr. Irwin Goldstein at the San Diego Sexual Medicine Center. About 36% of patients that he studied had pain with orgasm, and there's always been about 18% with spontaneous drainage, and when the masses that can occur down there can interfere with penetration as well in about 45% of the patients he studied. So sexual dysfunction is a big concern when it comes to these Bartholin's gland cysts. And when you have, and sometimes they just feel pressure and these sexual side effects, and other times there's a lot of pain associated with it, especially when it gets infected and it becomes an abscess. And what typically happens when you get a Bartholin's gland cyst is you may have it noted on exam when you get examined by whoever's doing your pelvic exams. Hopefully is looking at your vulva and not just sticking a speculum in or feeling down there. They can actually see it. You can see these abnormal enlargements in the lower part of the labia minora, the vestibule. And so again, for some patients it almost looks like two balls when they get really big. Other patients get it on just one side, and it looks like one labia becomes more prominent than the other. And so the Bartholin cyst can be a real troublemaker for patients, and they get them in recurrences. You get these obstructions in this duct that cause these cysts, and it can occur from infection. It can occur from surgery. It is a potential complication of vestibulectomies, which I have talked about when I talk about vestibulodynia. I can do a separate video on vestibulectomies, particularly when talking about acquired nerve proliferation or congenital nerve proliferation of the vestibule. And so, that's a potential side effect of having the vestibule removed, is causing the duct obstruction from trauma down there and from other infections. When we talk about those abscesses that form, or other infections can cause the cyst the gland to get obstructed. And then sometimes we don't know why. Again, because we don't do enough research in women's sexual health, until we're trying to change the narrative. And the numbers I presented earlier from Dr. Erwin Goldstein at the San Diego Sexual Medicine Center. What's typically done when patients come in with enlargements of the Bartholin's gland in the formation of a cyst or in the formation of an abscess, which is an infected fluid within the cyst. So it's not just mucin, but the mucin becomes infected and you get an abscess. What happens is, particularly when you have the abscess, you should have it drained. Most patients can't not have it drained. They usually present in the ER or the urgent care. Sometimes if they can get an urgent appointment with their gynae or sometimes primary care, they will find that the incision and drainage of the abscess will bring them immediate relief of symptoms, but may promote recurrence. So you get these infected areas down there. You get this swelling in your labia. It hurts to sit on it. It's red, it's angry, it's inflamed. And so someone will put an incision, in front of it and try to do it like within this area here so that it doesn't show much on the labia. So the inner hymenal area will make a small incision, and then you'll get a lot of purulent drainage. And sometimes it smells like an abscess does, and so we let it drain. And a lot of times patients will have what's called a word catheter, W-O-R-D, word. And it is a catheter that is inflamed. You can see the pictures here of this catheter. You inject saline into this about 4 cc's, and then it inflates like a bulb, and the thought is that you are going to maybe help the prevention of cyst formation. Again, allowing drainage, and you have to leave the bulb in. A lot of times they fall out. A lot of times patients can't handle the discomfort from down there, so it's not ideal. And so, but it is done a lot, and one of the treatment options. If someone has recurrences or somebody has a Bartholin cyst that's not causing, significant pain, but, maybe has less arousal, may have to use more lubricant, maybe it interferes with sexual intercourse, they have to move the labia aside for insertion, and they might just kind of be living with that discomfort. A lot of times we can then plan for a surgical marsupialization procedure. Marsupialization is just as you can think about a kangaroo is a marsupial with a pocket. We make an incision, allowing us to visualize where the cyst walls are, and this is done usually in an outpatient setting. You're asleep for the procedure, or at least heavily sedated, and it's not a long procedure, but the goal is to make an incision along the Bartholin's gland cyst, and then allow it to drain, but capture the cell walls and then suture that together to form an open pocket. Suture the cell walls, the cyst wall, to the gland, and allow an open pocket to form so that you get all the mucin draining happening and hopefully allow for less recurrences. And so this is a procedure that we do again in the outpatient setting, and it, obviously there is some risks: bleeding, infection, recurrences, discomfort, and sexual pain. Usually after about 4 to 6 weeks, when the sutures are absorbed by your body, most patients do really well. We usually have you still try to arouse yourself to allow for that mucin production to happen and for allowing that drainage to occur so that we know that everything is draining well. Again, it forms like an open pocket. You drain, the fluid comes draining out, and then hopefully you don't have as many issues in the future. And so that's your Bartholin's gland, that's your Bartholin's gland cyst and abscess. So a little quick video today. I've just been seeing some uptick for some reason in my office. Again, it's an important part of our anatomy, the Bartholin's gland. It's important for that production of mucin that's used for arousal. And so, if you're having issues with it, if you notice a swelling down there, if you notice a discomfort in that area, please see someone who can help you. Most gynecologists are trained in this procedure and can help with that marsupialization process. And if it's an urgent issue with an abscess, of course, in most places, we'll be able to drain it and give you the comfort relief you need. We're learning more and more about the Bartholin's gland, and so as we find out in the years to come, I will update you. But for now, we are still using marsupialization as a primary treatment for persistent or recurrent Bartholin's cyst. And that's it. That's all I have to say today about the Bartholin's gland. Hopefully you guys learned a little bit of something. I'm sure there's a lot of patients suffer. A very, 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 very small percentage of patients that are in the menopausal age that get these cysts. Sometimes in postmenopausal women or patients, it's really among patients that are in their 60s or more, we may choose to remove the Bartholin's gland altogether. Primary Bartholin's glands cancer are very rare. I think it's like 0.1 to 5% of all vulvar cancers are Bartholin's carcinomas, and it's 0.0001% of all female cancers. So it is pretty rare, and the procedure of choice is usually to remove the Bartholin's gland, which can result in dryness in that area and sexual pain. But of course, if there's concerns about any carcinoma, that should be done. Again, it's pretty rare. It's something that is usually an extensive and deep dissection, and so it can cause a lot of scarring and issues around excessive bleeding. When I was in Los Angeles County, we did have a few of these that we did because we did see patients over the age of 60 who did present with these Bartholin's gland cyst recurrences, and so it's much easier to remove that 2.5 centimeter duct. That's about 0.5 centimeters in size, and so it's easier to remove it when it's obviously a little bit enlarged with a cyst, or if you're concerned about any kind of cancerous growth, we would remove it as well. And again, that's a rare thing, and not many patients have to live through that, thankfully. So in conclusion, I just wanted to say that Bartholin's glands are very important for a woman's sexual response. I wanted to also just reiterate a couple of facts. Usually when cysts are small, and usually when I'm talking about small, they're less than 3 centimeters in size. I forgot to mention that we do just usually recommend trying to use some warm compresses or sitz baths to see if that will elicit a drainage, which many times that happens when the masses are small, and it can allow for resolution of symptoms. And then when they become abscesses or larger, we do recommend either incision and drainage or procedures related to as I described. And there's really no role for antibiotics in the treatment when it comes to the cyst wall, Bartholin's cyst wall, or abscesses. So we don't usually do that. And again, primary Bartholin's gland cancer is very rare, but when it is there, you have to remove the glands altogether. Thanks for joining me today. That's all I wanted to say about Bartholin's gland cyst and Bartholin's glands and Bartholin's gland abscess. So I hope you learned a little something, and you'll come back next week to join me for more information. Please, again, like and subscribe to my channel, and we'll see you next time.